Joining us is an expert who works at the forefront of healthcare, technology, and policy and is focused on cutting the red tape in the healthcare system. Pooja Babbrah, thanks so much for being here.
Oh, thank you for having me. Appreciate it.
So let's just start with the reality of what a lot of patients are dealing with right now, how the current authorization system really can delay care, delay people getting treatments and prescriptions.
Yeah, absolutely. And I think we've all faced this, whether as a patient or as a parent that's taking care of their child. You go to the doctor, they end up giving you a prescription, or they say, let's get you in for an x-ray or something. And following the medication path, you end up at the pharmacy, you go to the prescription, pick up the prescription, and the pharmacist says, I can't give it to you because I need insurance approval.
It hasn't been approved yet.
It hasn't been approved yet. And you leave the pharmacy counter and you don't know when it's going to get approved. You don't know if it's going to get approved. And a lot of times people don't come back. I mean, there's a big risk of abandonment, that people just don't get on their therapies because they end up leaving the pharmacy or don't get the tests done, and that's a major issue.
We've heard nightmare stories all across the country of people who need significant treatment, life-saving treatment, and it's delayed. Maybe they don't even get it because they're waiting for approval.
Absolutely.
Right? So this is a big change. More than 50 insurers say that they're going to cut this sort of authorization process. They already have by 11%. What is driving that, and why the change now?
Yeah, so there was last summer, actually, a lot of these health plans went to the White House and made a pledge, and they said that we recognize that this is a big red tape, and we want to actually do something about it. What's been interesting, it has been good to see the 11%, but you've got to move from pledges to performance, right? Yeah, so we're kind of tracking it on how are they actually performing, and they actually took pledges on other things, like how do you automate things, how do you make it more transparent. So some of those things are still coming down the pipe. Yeah.
What does it mean for patients right now who maybe they still are waiting for an authorization?
Yeah, I think with that 11%, the main thing that we're seeing is like chronic conditions. I've heard story after story of patients who their child was on an inhaler, and then all of a sudden the next month they need a prior authorization. So what we're seeing in the data is that 11% is cutting some of those chronic medications that people have been on in the past, or when they switch insurance and they need to get the prior authorization again. So some of that I'm hoping that some of the patients are starting to see at the pharmacy counter, that they don't need as many prior authorizations.
I'm really curious what you think about this. There's been this push to move a lot of the process online to make decisions faster, maybe even incorporate AI. Will that make a difference, and are there risks with that? Should people be concerned?
Yeah, the organization I work for, we've had a standard, a way for all the systems to talk for almost a decade now.
Wow.
So it is pretty frustrating to see that we're still in the same place, right? But I do believe that going online, making it electronic will make it easier. I know there's always concerns about AI, but if you think about all the data that AI can actually use to help make, at least inform to make a decision, I think people shouldn't be worried about that, as long as the AI is not making the actual determination.
I've heard some concerns that people fear it could increase denials rather than approvals. Have you heard that?
I have heard that, and what's interesting is with some of the new rules coming from the government, all the health plans actually have to make transparent how many denials they have. So the first set of data just came out a couple weeks ago, and it's just been fascinating. It's going to be interesting to watch that.
Especially because it gets very tricky as people move from company to company, which means insurance company to insurance company, or kids are coming off their school insurance for college and now they're going into a company. And there's so many layers involved in transferring care. Right?
Absolutely, yeah, and that's another thing that they're trying to fix, is if you're moving from one insurance to the other, all that data should move with you, you are the patient. So hoping to see some changes there as well.
Last question.
Yeah.
So looking ahead to all of these changes, which will supposedly go into effect and get even better into the next year, what should we expect?
Yeah, I think as patients, as consumers of healthcare, we should hopefully see less prior authorizations, but if there is one, it's going to be transparent, it should be a lot faster, and you should be able to be communicated with of how long it's going to take to get that prior auth. So
maybe we'll have you come back to do a sort of a report card
on
how it's going in 6 months to a year.
Yeah,
Pooja Babbrah, thank you so much for helping us sort of
Absolutely.
understand what can be a very complicated process and how it's going to make a big difference for a lot of people.
Yeah.
Thank
Yes.
you.